Elbow joint. Elbow joint is a joint of hinge variety. It is a synovial hinge joint. So coming to the articular surfaces, the upper articular surface consists of capitulum and trochlea or humerus. Coronoid fossus lies just above the trochlea so that the coronoid fossa of ulna fits into it in its extreme flexion. Radial fossa lies just above the capitulum, which allows radial head fitting in the radial fossa in extreme flexion. So here you can see the upper articular surfaces, capitulum and trochlea of humerus. The just above the capitulum lies the radial fossa. So the head of the radius fits into the radial fossa in extreme flexion. Here above the trochlea is the coronoid fossus. The coronoid process of ulna fits into the coronoid fossa of humerus in extreme flexion. The lower articular surfaces include upper surface of head of radius articulates with the capitulum and trochlear notch of ulna articulates with the trochlea of humerus. As you can see in the diagram, I have underlined both the things. The head of the radius articulates with the capitulum of the trochlea. Then again, the trochlear notch of ulna articulates with the trochlea of the humerus. These again are the articular surfaces you can see in these. Cubital articulations. Elbow joint is continuous with the superior radioulnar joint. The three joints which are formed are humeroradial joint, humeroulnar joint and superior-radial ulnar joint. Articular capsule. A sac enclosing a joint formed by an outer fibrous membrane and an inner synovial membrane is known as the joint capsule. This consists of the articular capsule. This is the joint capsule here. Joint capsule is superiorly attached to the lower end of humerus. Inframedially, it is attached to the trochlear notch of ulna, and infralaterally, it is attached to the annular ligament of superior radial ulnar joint. Here you can see the pointer is pointing towards the annular ligament of the superior radial ulnar joint. Synovial membrane lines the joint capsule. The ligaments are anterior ligament, posterior ligament, ulnar collateral ligament and radial collateral ligament. The anterior and posterior ligaments are basically the thickenings of the joint capsule. This is the joint capsule underlined in blue. Ulnar collateral ligament is triangular in shape. Its apex is attached to the medial condyle, base is attached to the ulna. The ulnar collateral ligaments has basically three bands: anterior band, posterior band and an oblique band. The anterior and posterior bands are attached to the olecranon and coronoid processes. The both of these anterior and posterior bands are joined by oblique band, which is thinner intermediate fiber. The ulnar collateral ligament is crossed by ulnar nerve and it gives origin to flexor digitorum superficialis muscle. Here you can see more clearly, this is the anterior band, this is the posterior band and this is the oblique band. The ulnar nerve crosses it. Radial collateral ligament is fan shaped. It extends from the lateral epicondyle to the annular ligament of superior radioulnar joint. It gives origin to supinator and extensor carpi radialis brevis. Relations anteriorly consist of brachialis, median nerve, brachial artery and tendon of biceps brachii. Here you can see biceps, median nerve and brachial artery. Posteriorly are the triceps brachii and inconius. In this diagram you can see the triceps and inconius is somewhere here attached. Medially it consists of ulnar nerve, flexor carpi ulnaris and common flexors. Thank you.